Hello there, our subject today is about osteoarthritis. Osteoarthritis is the most common type of arthritis affecting tissue of all joint, cartilage, and meniscal degeneration. Meniscal degeneration, all tissue, cartilage, all tissue of joint cartilage. Most common site, lower cervical, lumbar spine, hips, knees, DIP, PIP, and first metacarpal joint. DIP, distal interphalangeal, PIP, proximal interphalangeal. Characteristic finding of OA, osteoarthritis, OA. Joint pain should be exacerbated by activity, relieved by rest. Morning stiffness, also less than 30 minutes, while in rheumatoid arthritis, stiffness more than 1 hour. There's reduced joint motion. There is crepitus, tenderness along the joint line, bony enlargement, including Heberden and Bouchard nodes, involvement of the first metacarpal joint with squaring at the base of the thumb. Note: individual joint in hand may be swollen in OA or erythematous in OA. If there is a multiple, what do you think? You should suggest another thing with osteoarthritis. We should suggest concomitant CPP deposition or rheumatoid arthritis RA. Osteoarthritis is the probable cause if the distal interphalangeal joint involved. If the distal, this is the proximal, this is interphalangeal, this is distal. If the distal, this is the mostly osteoarthritis. Rheumatoid and psoriatic is a probable if MCP joint, wrist, elbow is involved. Okay, what is about the type of osteoarthritis? The first, erosive inflammatory. The second is dish. The third is secondary to another cause. Erosive inflammatory osteoarthritis. There is a pain and palpable swelling of the soft tissue in the PIP and DIP joint, proximal and distal, interphalangeal. May be associated with disease flare. Erosive. It is a common in distal. This is the problem, distal. OA mostly distal. Erosive mostly in distal interphalangeal joint. The other type is dish. What mean by dish? Diffuse, idiopathic, skeletal, hyperosteosis. Also it is called Forester disease. Often dish is asymptomatic, following ossification along the anterolateral aspect of the vertebral bodies. It is considered in a form of degenerative arthritis. It is apart from OA. It is characterized by unique following calcification along the side of the contiguous vertebrae of the spine. Neither disc space narrowing nor syndesmophyte are visible as spondylosis. يعني مو مثل السبونديلوسيس الدش، يعني neither disc space narrow or syndesmophyte ماكو اثنيناتن، مو مثل السبونديلوسيس. Complication include dysphagia, Complications include dysphagia, unstable spinal fracture, spinal stenosis, and myelopathy. Myelopathy in the muscle, spinal stenosis, it is in the vertebra, to remember. Spinal fracture, it is in vertebra, and dysphagia also. What about secondary OA? Secondary OA, in a previous joint injury, secondary OA may develop, or metabolic cause such as hemochromatosis. Consider metabolic cause if atypical joint, MCP, shoulder, wrist joint are involved. Secondary usually in this joint, MCP, shoulder, wrist. Secondary, this is a secondary OA. Well, what about the diagnosis? Diagnosis: X-ray, ultrasound, we have blood investigation. X-ray is the most important. It is not helpful, sorry for this wrong, it's not G, helpful, in hand osteoarthritis, but the X-ray is the gold standard for hip and knee. Hip and knee. X-ray is not helpful in hand, but helpful and the gold standard for hip and knee. Also, blood investigation is not helpful. Yes. What about this X-ray? This is a hand, proximal, interphalangeal, and distal, and metacarpal. There is an arrow of joint space, and sclerosis and osteophyte are shown. Involvement prominent in PIP and TIP. This is the PIP. This is the TIP. This is narrow joint space and osteophyte. What about this knee X-ray? It is the gold standard, but here is not gold standard, and may not help, may at all not helpful. Medical compartment joint space narrow. This is a space narrow. It should be more than this space in normal. Subcondylar sclerosis. This is subcondylar sclerosis. Well, in synovial fluid there should be in osteoarthritis, the inflammatory cell white BC should be less than 2000. Keep in your mind, because joint aspiration may need, especially in treatment with glucocorticoid. What about the treatment? Treatment in the top, non-steroidal anti-inflammatory, either topical or oral. Topical for those contraindicated. Okay. It is always NSAID superior to tramadol, to opioid in general. In multiple study, NSAID is the most effective and better than opioid. Intra-articular glucocorticoid may be also used if patient still complain. But before intra-articular glucocorticoid administration, aspiration of fluid of joint should be done and should be non-inflammatory. Non-inflammatory means less than 2000 cell. Quadriceps strengthening exercise for those in knee and hips, especially for knee exercise. Weight loss, especially for hips, those with heavy weight should be weight loss. A part, very important part from treatment. Arthroplasty is the last choice if there is no response to this medication or this intractable pain, and to improve lifestyle of patient. Thank you for watching.